Alright, it's time we talk about COVID. By now, as I'm sure you've heard, there's a global pandemic going on, and it may not be going away anytime soon. But let's talk about some solutions. Recently, the news has been filled with hopes of a vaccine potentially being ready by September. Link down below if you want to read about that. But I want to talk about herd immunity, or more specifically, what would happen if every country around the world attempted to go for herd immunity. Before we dive in though, what exactly is herd immunity? Herd immunity can be achieved through two ways, a vaccine and natural infection. For the sake of this video, we'll be ignoring the vaccine side of things and looking at natural infection, since that's more of a hypothetical. The concept of herd immunity is pretty simple. Basically, when a large portion of a population, around 70% or higher for COVID, becomes immune to a disease, that is, catches it and develops immunity, the spread becomes less and less likely. Eventually, the disease loses the ability to infect enough people to remain a threat. So now that we have that out of the way, what would happen if every country tried for COVID herd immunity? Let's say every country had no restrictions put in place and never shut down. Everything was the same as before. No face coverings, no social distancing. What would happen? Well, the short answer is that it would never be achieved through natural infection, but I'll explain why in a minute. First, let's turn to Sweden, which is one of these countries. This isn't as far-fetched of a hypothetical as you may think, because Sweden actually never shut down in the first place. You see, years ago, in March, the Swedish government announced that they would be taking an unorthodox approach to containing COVID by not actually containing it at all. Businesses never closed their doors, schools were kept open, society kept going, and it didn't really work. According to Johns Hopkins, as of recording this video, there have been 5,619 COVID deaths in Sweden. For comparison, their Baltic neighbors of Finland, Denmark, and Norway have only recorded 1,194 deaths combined. So why is Sweden's death tally so high? Well, they overloaded their hospitals. There weren't enough doctors to treat all of their patients, so people died of COVID untreated. In countries like Finland, Denmark, and Norway, this didn't happen because they shut down early. But what about Sweden's immunity numbers? Well, again, it's complicated. Nobody really knows. Recent data published by Sweden's Public Health Agency in June suggests that just 10% of Stockholm's population had developed antibodies. Antibodies are proteins in your body that bind to foreign invaders, like viruses, and mark them for the immune system to clean them up. But Sweden has been trying for herd immunity since March, so why only 10%? For more on that, we turn to Spain. The case for herd immunity only worsens when you look at Spain. The country was hit hard in the spring of 2020, but managed to slow their spread through lockdowns and social distancing. As of recording this video, Spain has recorded over 260,000 confirmed cases of COVID and around 28,000 deaths. The actual number of cases is estimated to be much higher due to limited testing and other factors though. For reference, Sweden has just over 77,000 confirmed cases of COVID. So that's a lot of COVID cases in Spain, which means that a good amount of their population should have antibodies, right? Well, apparently not, no. See, a recent study conducted in Spain suggests that just 5% of the country's population has developed COVID antibodies, even in hotspot areas. That's not a very big number. But wait, there's more. Multiple studies from the UK and China suggest that COVID antibodies may only last months. For comparison, antibodies for the SARS virus, a close relative of COVID, are maintained for an average of 2 years. To put this into perspective, this means that at least 70% of a population in any country would have to catch and recover from COVID in just a few months for herd immunity to occur. Even then though, if the antibodies in those who were immune faded prior to COVID dying out in the remaining 30% of said population, the disease could make a comeback. Basically, I'm saying it's possible to be infected by COVID twice, and we're beginning to see that in certain hotspots around the world. With a disease like COVID, a vaccine seems to be the only way out. Herd immunity isn't happening through natural infection. Okay, but let's say that even with all this information, governments still push for herd immunity and no societal restrictions. What would happen? Well, a lot of people would die. We just don't exactly know how many. Recently, around 1,300 scientists met to come to a conclusion on COVID's fatality rate. The number they decided on? 0.6%. Which is about 6 times deadlier than the seasonal flu. But remember our hypothetical. Every country in the world is doing this. So by doing some quick math, carrying the 2, moving the 7 around, if every person on the planet were to catch COVID, around 47 million people would die. That's a lot of people. That's more than 2 World War I's worth of death. If you want to go into specific countries, let's take a look at the United States. The US has, without a doubt, been the hardest hit country of this pandemic. But in our scenario, around 2 million people would die, which is magnitudes higher than the current death count. Even if herd immunity through natural infection did work for COVID, which it wouldn't, it probably wouldn't be worth it to try. That's my answer to this hypothetical. With a situation like this, it's important to note that new discoveries are being made every day. If you're watching this video a few weeks, months, or years from now, some of this info could be outdated. As of now though, it's the best stuff we've got. If you've made it this far into the video, please feel free to like and subscribe. New videos weekly. Additionally, feel free to leave feedback in the comments below and recommend some hypotheticals of your own. All of my research links will be in the description. Okay, that's all I've got. See you next week.
Okay, bye.